Hey everyone, my name's Anthony Macklin, and you're watching KTL News Now. We have Dr. Joe A. Hughes, who is nationally recognized as an advocate for mental health, and she is here today to talk about sports and how it can support mental health. Joe, thank you so much for being here today.
Thank you. Thank you for having me.
So, how can activities like team sports, sort of help people who are dealing with their mental health form routines or create stability in their lives?
Well, I think it depends on the age, right? Of course, if we're looking, I think it means something different for different age groups. The younger the child, we're just looking about how to take turns and how to be part of a group and, not do just follow the ball like herd, right? Herd mentality. In adolescence, we're bridging neurotransmitters are growing and we're becoming the adult brain we want to be. We're bridging into social connections, right? And so having a social connection that sports teams can facilitate are very important to this stage of development in adolescence, especially.
And how does that aspect of teamwork help mental health in general? And like which mental illness can it positively impact the most in your opinion?
Again, I think if we're going to use the adolescent example, when, we're talking ages from like maybe 11 to 16, where we have these social connections, trying to figure out who we're going to be in life and what that looks like. And I think when you are part of an organization and a team, there's that mentality of I belong, right? And I think it can stave off depression symptoms and anxiety, especially social anxiety. If you have experience in with your teammates of how to approach a problem, which would be a game or reaching a goal for a common unity. I think that really helps stave off some of those underlying mental health issues that may be percolating, if you will, because of genetic reasons. And this can help balance that.
And when it comes to individuals who, have severe mental illnesses like bipolar 1 disorder, for example, how can participating in sports benefit them specifically?
Well, bipolar one folks usually are pretty sick individuals, right? And I think, again, a lot of people who have bipolar disorder live in the depressive state more than the manic state. When someone's in a manic phase, they're the life of the party, they're energized, they're all over the place. They're very, very social typically, over too much so, right? And then that depression where you don't want to get out of the house, you have low energy, low motivation, your focus may be impaired. If you're physically moving your body, that we know releases endorphins and helps with dopamine and the reward pathway and the executive function. So again, those folks that have bipolar depression who live kind of in that space most times, I think getting up and having an activity, a group, someone else counting on you, again, can help branch and stave off some of the more nuances of depression per se, along with a good therapeutic relationship and medications for a bipolar 1 patient.
And could you go into a bit of the science of the relationship between physical activity and improvements in, mood, energy, and sleep? I know you were talking about the depressive aspect of things. So could you just say what kind of how that benefits them in their everyday life?
Absolutely. There's a lot of research that shows us how when the more physically active we are, we're reducing inflammation, right? Our body's moving, we're reducing inflammation. Inflammation is not only important in cardiovascular disease and vascular issues, but also depression. When we have a heightened stress response, we actually create more inflammation, which can then go into our brain and affect our hippocampal volume, which shrinks. And hippocampus is responsible for memories and cognitive function. So when we have depression, we have inflammation that can shrink. And having the right, and exercise can help release dopamine and help that. And dopamine is a very powerful neurotransmitter in the reward pathway, the motor pathway, the limbic system, where we have all these strong emotional places, and the prefrontal cortex, where we have executive function.
And how can combining medical treatment with, the social aspects and discipline of sports benefit mental health long term?
Well, in my opinion, I haven't read a study to speak to this specifically, But I think, in my opinion, the more, again, if we're dealing, medications are going to help the neurochemistry of the brain. Like that's what they're designed to do, especially with somebody as ill as somebody with bipolar 1 disorder. These individuals will most likely have to be on medication the rest of their life to stay stable. And they can very help and in a very positive, fulfilling way. Being part of a team and again, keeping us recognizing, have that camaraderie and that exercise that um, kind of we as a society, I think, do better when we're with groups and we feel a sense of belonging. One of the number one killers of our elderly population is loneliness. And so I think when you're on a team sport, it kind of can put together some of that, can counteract some of that loneliness and feeling again like you're a part of something bigger than yourself. And that's very important for mental health.
And when it comes to participating in those team sports and team environments, it's usually, about putting the team first to help them succeed. How can that mentality be applied to mental health care when it comes to, like working with providers, patients, and caregivers?
Let me rephrase, make sure I understand. You mean, well, I think what you're asking is when someone who has medications and who's in therapy, all those things work in like it's like a perfect wheel and machine. It's just well oiled. When everything's working well, everything else in life will fall into place. Of course, we're going to have our ups and downs. Nothing is perfect. But the idea is, can you go through those ups and downs without dipping too high or too low? Are you able to tolerate that? And I think some of the skill set you learn in being part of a bigger group, bigger than yourselves with common goals, can really help facilitate that as well and keeping patients mentally stable.
Is there anything that I didn't ask you today that you wanted to kind of touch on?
No, I do. Well, I will say this about sports in general. I feel like there is a definite positive side to it. There can also be a negative side, and I think having the right coach and the right environment and the right home life that helps facilitate, that helps encourage this in a way that is beneficial for everybody is also equally important. It's not just about the sports team, it's about the whole community around it and your psychosocial situation.
And do you have any specific resources for, people to reach out to or kind of to figure out how to get help?
Well, NAMI is a great organization. It's a National Alliance of Mental Health, and it's a great organization that's nationwide that supports family members also along with patients. So that would be where I would start first. And then also your local chapter of NAMI, but also there's usually some mental health organizations. In my community, we have a nonprofit organizations that helps serious mental health cases, patients who are on disability, but who want to work and feel that need, but have, because of their illness, have had struggled with that. Kind of other nonprofits, I think, pop up all over the place and usually led by somebody who's had a personal experience with mental health issues.
Then one more, could you sort of go into how someone who may be dealing with mental health issues, they want to try to overcome this barrier when it comes to signing up for like a team sport or whatever? Is there any way or advice that you have for them to kind of motivate them to be active and just improve their life?
I want to say that having a mental health issue shouldn't stop you from participating. Just like I can't see very well, so doesn't mean I shouldn't drive. I put glasses on and I can drive. I think with patients, people who have mental health issues, seek help. If you can, if you have a good provider in your area, if you have therapy that's available to you, all these are very important in helping you become stable, but don't let that stop you, right? I think there's too many benefits from that community, the social aspect, along with the physical aspect that we know helps with mental health. It's only going to help you, right? It's only going to help. So I recommend, finding that and seeking out, but don't let it stop you. Shouldn't stop you.
And do you personally have any experience with like working in that sort of like team sports setting or just playing?
Well, it's kind of funny you should say that. Um, I have it from a personal point of view. My son is 23 years old and he was drafted by the New York Yankees last July.
Oh,
And
wow.
yeah, so he's been involved in baseball since he was 5. So I can tell you, growing up and having that personal experience and knowing and seeing other families and other baseball members and teammates, what they have gone through and how they've circumvented their mental illness and their anxiety, performance anxiety, depression, not being, there's a whole slew of things, not just the underlying genetic component, but then you have these social triggers of I wasn't picked or I'm not on this team or I don't get enough playing time. And oh my, we've been through it. But so I do have this personal experience and seeing it from the personal, from that point of view from my son. And I'm very grateful to have had that because I've also treated other baseball players and other athletes to helping them recognize that, yeah, you can do this. Yeah.
That's really awesome.
Thank-
Thank you so much for taking the time to meet with me today.
Absolutely. Thank you so much for having me. Appreciate
And,
it.
and if you haven't yet, be sure to visit us at ktlnews.com to get all of your breaking news, local stories, and trending topics. You can catch us on KTL News Now every Tuesday and Wednesday at 1 p.m. But for now, I'm Anthony Macklin, and thank you for joining us.